I think certainly from ABHI, selfishly thinking about it from our perspective, it's about how do we continue to build and strengthen that kind of transatlantic corridor, if you like, and how do we try and create that sort of metaphorical healthcare bridge between the UK and the state of Tennessee, which will allow innovation to flow in both directions, but also allow for some of those institutional collaborations to happen between research assets, between healthcare providers, whether that's hospitals like we're represented today through Bart's Health and others and so on, working with providers here around some of those common healthcare challenges. So it's how do we wrap all of that out? How do we get folks in the room, talking to one another, collaborating with one another, building those long-term relationships that fundamentally will benefit patients on both sides of the Atlantic?
It's incredibly exciting. And a mantra of the global health innovators is serendipity. It doesn't happen by accident. And so much of what you're describing is the intentionality with which we make these conversations happen. We bring delegations to one another. We establish programs like we just announced here in Nashville, the Light program, right? There's so much exciting work. So feels like an appropriate question to end on. Tell us about a moment of serendipity in your career for ABHI, whatever that looks like, but a conversation, a connection, a wrong turn that ended up being exactly right and led to a moment of serendipity.
And specifically with Nashville started nearly 15 years ago with a group that was led by your governor at the time coming over to the UK. And it was effectively a chance meet almost in the UK at a reception with our organization and a number in the room that were representing healthcare as part of that grouping. And it was a handshake, and it was just we were thrust together in that moment and said, we've got to know about Nashville, got to know about Tennessee, this incredible place, you've got to come and visit. And we were persuaded over the course of, I think, half a glass of wine, that probably helped. Easy sell. And then we made the visit over, and that was it. We never looked back. So I think you touched on this at various points during this afternoon. It's often those connections, those choice pieces of sort of serendipity that happen around that kind of start a conversation, and it will just snowballs from there.